Hello, it's Olivia K again. I made a video last night regarding about first versus best questions. Today I'm going to go over priority. I decided to do that because I think a lot of people are having issues with how to approach them and how to answer them. What I'm going to do is I'm going to leave a link, or I'm also going to tell you to check out Mark K if you're able to get a hold of his lectures, especially lecture 12, because that's what also helped me too. And I listened to that lecture religiously. Because of that, I was able to figure out prioritization. And it's a skill an RN and LPN should have, because it will help you answer NCLEX questions and also help you in real life situations when you're working. So priority questions, they're usually framed, there's usually different ways you can determine how you're going to answer priority type questions. So the one that often you'll see is acute versus chronic. And with that rule, and even Mark K says this, acute will always beat chronic. Then there's expected versus unexpected. So in that situation, you have patients that have either a change in condition, but then it may be expected with the disease process they're going through, or somebody who doesn't have any past medical history and just has a sudden change in condition, like maybe a spike or a change in labs, or they're symptomatic and for whatever reason they don't have this chronic disease they're dealing with, and it could be from whatever it is, and you're not sure whether it's an infection or they have a new problem. And then another thing can be, especially if a person is suddenly confused, so they could be either delirious or they have a infection brewing them and we're not sure why that is, or they're short breath or experiencing shortness of breath. So it's important to also kind of see and understand what will take priority and what will beat the rest. Then there's Maslow hierarchy of needs, or the ever famous airway ABC, so airway, breathing, and circulation. So I would encourage you to look through and find Mark K videos, not videos, but the lectures. And I also recommend this too. Your Nursing Space will have bundles of Mark K recent videos. I think they're from 2 or 3 years ago, and he has priority type questions, delegation, which is another thing I'm probably going to cover. So I do encourage you to look through it. Simple Nursing has it. Which other way is going to help you remember that prioritization is key, and you do need to look over those videos or lectures to help you. So I'll think of an example now for prioritization. So a nurse will have 4 patients. So she's just coming into the med-surg, the floor right now, and she needs to know who to see first. So a COPD patient that has the oxygen, he has the oxygen on 2 liters, and he has 90%. Then you have your CHF patient that has mild swelling to the lower, the bilateral lower extremities, right? Then you have this patient post-op, let's say hernia repair, and they're very confused. They don't know their name. They don't know what's going on. They don't know why they're there. Then you have the patient, the last option, the patient who has an IV and their skin is pale and their hands swollen. You're not sure why. So out of all those options, who would you see first? So as much as you would want to pick the one that has IV, the swelling arm, you would actually go for the confused patient. They take priority because that's new. You don't know what's going on in them or why. So you're going to need to do labs. The IV patient would take second priority because for whatever reason, it could just be phlebitis, or they need to get a new line. They'll have to get a new line put in, for whatever reason. But in this case, it would be the confused patient, because this is acute versus chronic, or expected versus unexpected, even though IV would be unexpected in this case too, but complications can occur anytime, and this person probably still learn oriented. Whereas the confused patient, you don't know what is going on. They could be septic for all you know. They could have an infection brewing, who knows? So they would take priority. So which is why I say, and I encourage you to look at Mark K for the prioritization. He is the best. He's the very best. I'll also link Your Nursing Space into this video, so that way you can be able to get the bundles and you can get his recent lectures and videos, and he'll go over it. So that's what I have for you today, and I think I'll do delegation next. So I hope that helps. And again, if you have any questions, I'm on Facebook, I am on Reddit, I am on Instagram, so you can ask me any questions you like regarding NCLEX. So I hope that helps. All right, bye.